Alex Tin here at CBS is reporting Florida's Surgeon General and a former Texas Congressman, Michael Burgess, are both being floated for the job. How important is it to get someone confirmed and in the role quickly?
Yeah, I think it's very important, especially when you see what's going on around the country with this measles outbreak in West Texas. We may have more measles cases this year than we've had in 25 years, and so having leadership at the CDC that can direct that response is exceedingly important. Mike Burgess ran the Health Subcommittee on Energy and Commerce, worked closely with the FDA when I was there. He was very good, very effective. He did a lot to advance our interdiction work in mail facilities to stop opioids from flowing through those facilities. He was very dedicated to that effort. Actually visited the mail facility in New York at JFK Airport to see firsthand the operation before he led a charge in Congress to help provide more funding to get more inspectors into those facilities. So he has a lot of experience in a lot of the areas where CDC has a very relevant mission.
Mm-hmm. And they'll have to face a potential vote once the president makes a selection here. I want to ask about some of the byproducts and some of them deliberate cuts from the president's so-called belt tightening here. There have been impacts at, for example, Johns Hopkins, an institute that does medical research and receives USAID grants. There are also deliberate cuts that have been vowed at Columbia and UPenn, two universities that get federal funding and do health research. Do you have any insight into how many health programs or the significance of the health programs that'll be affected?
Yeah, I don't think anyone has insight into it yet. I think this is still playing out. These impacts are happening across a couple of different domains. There's restrictions on the ability to go forward with new grants because of limitations, for example, posting things in the Federal Register. There's new grant-making policies that are being implemented, so certain entities, certain countries are being added to lists where you can't do research. There were recently some grants canceled that coincided with research that would be done in conjunction with China. They're terminating certain grants on the basis of policy considerations, like whether or not they have a certain DEI component, and however they're defining that. And then you see the institutional-wide cuts. I think that's what happened to Johns Hopkins with respect to the USAID cuts. It's also what happened to Columbia with respect to that $400 million cut, federal cut, that impacted a lot of research. So there's multiple domains where they're being impacted right now. This isn't all DOGE-led. I think we need to be very careful when it comes to research programs where patients are involved. You know, if you make a mistake with a program like a website that you took down, you can always put it back up. But when you cut a grant to a program where patients are involved, where continuity of care is really important to those patients, you need to make accommodation for that or not make those cuts in the first place. I do know I've had some conversations. I think DOGE is aware of that and trying to be mindful of those impacts.
It's an important point to be strategic when it comes to medical care. Dr. Gottlieb, thank you for your insight. We'll be back in a moment.